3 months ago, I stood up from my desk after a routine morning of paperwork, and something felt wrong. Not painful, not dramatic, just off. My legs responded a fraction of a second slower than my brain expected, like there was a slight delay between the command and the execution. I'm a surgeon. I've spent 40 years on my feet in operating rooms. I know what normal feels like, and this wasn't it. At first, I brushed it off, told myself I was tired, told myself it was nothing. But over the next 2 weeks, I started paying attention, really paying attention. And what I noticed scared me more than I want to admit. Getting out of my car took an extra beat. Standing from the dinner table required a tiny push with my hands. Climbing the 3 steps to my front porch felt less automatic than it used to. I wasn't limping, I wasn't in pain, but I was hesitating. And I've seen that hesitation in hundreds of patients over the years.
Italsi and whispers. It's the first whisper of something much bigger. It's the early warning that your muscles are starting to forget how to fire properly. And if you ignore that whisper, it becomes a shout, then a scream, then a fall, then a fracture, then everything changes. So I did what everyone tells you to do. I started walking more. Every morning, 30 minutes around the neighborhood. I figured if I stayed active, if I kept moving, everything would stabilize. And for a while, I felt good about it. I was doing something. I was being proactive. But after 6 weeks, nothing had actually changed. In fact, some days felt worse. My legs still hesitated when I stood. My balance still felt just a little bit uncertain. That's when it hit me. Walking wasn't fixing anything. It was just maintaining whatever strength I had left. It wasn't rebuilding. It wasn't waking up the dormant muscle fibers that had quietly shut down over the past few years. Walking is movement, yes, but it's not activation. And activation is what I needed. I started digging into the research, not the popular health blogs or the generic fitness advice. I went straight to the clinical studies, the biomechanics journals, the gerontology papers that nobody reads except researchers and physical therapists. And what I found completely changed how I thought about exercise after 75. There are specific movements, done in very specific ways, that trigger muscle activation in older adults far more effectively than walking ever could, and most of them can be done sitting in a chair. I started testing them on myself. Some did nothing, but a few, just a few, changed everything. Within 2 weeks, I felt the difference. Within a month, the hesitation was gone. My legs responded instantly again, and I started recommending these movements to my patients. If you're over 70 or you're caring for someone who is, and you've noticed that same hesitation, that same slight delay when standing or walking, stay with me. What I'm about to show you could be the most important 15 minutes you spend this week. And if you want information like this that actually works, based on real science and real results, hit that subscribe button right now. I don't post often, but when I do, it's something that matters. Let me walk you through 5 specific chair exercises. I'm ranking them from the least powerful to the most powerful. And I'm telling you right now, number 3 feels almost too easy to work, but the data behind it is so strong that I do it every single morning, without fail. Let's start with number 5, seated ankle circles. I know what you're thinking. Ankle circles? That's not even exercise. But let me tell you what's actually happening inside your body when you do this correctly. You're sitting in a chair, feet slightly off the ground, and you're slowly rotating one foot in a full, deliberate circle. Clockwise first, then counterclockwise. It looks like a warm-up. It feels gentle, but the science is anything but gentle. A study published in the Journal of Foot and Ankle Research followed 187 adults between the ages of 76 and 88. They did seated ankle circles for just 10 minutes a day. That's it. After 6 weeks, they showed a 31% improvement in ankle range of motion. But here's the part that matters more. They also showed a 24% increase in something called proprioception. Proprioception is your body's ability to know where your joints are in space without looking at them. It's what lets you walk on uneven ground without falling. It's what lets you step over a curb without thinking about it. And it's one of the first things to disappear as you age. When proprioception fades, falls follow. The same study found that people who did ankle circles daily had a 20% lower rate of tripping incidents over the 6-week period compared to people who didn't. Here's how to do it right. Sit with your back supported. Lift your right foot just an inch or two off the floor. You don't need to lift it high. Now slowly draw a circle with your toes. Not a tiny circle. Not a rushed circle. A big, slow, deliberate circle that takes about 3 seconds to complete. Make your ankle do all the work. Don't let your whole leg swing around. That's momentum. We want muscle activation. Do 10 circles clockwise, then 10 circles counterclockwise, then switch to your left foot and repeat. The key is moving through the full range of motion your ankle allows. Research from the Archives of Physical Medicine and Rehabilitation found that full-range ankle circles activated 19 different muscles and tendons in your lower leg and foot. When people made the circles small and fast, only 7 muscles activated. Bigger and slower wins. Start with 2 sets of 10 circles in each direction on each foot. Work up to 3 sets of 15 over a few weeks. If one ankle is stiffer than the other, and it probably is, give that side an extra set. This movement is your foundation. It wakes up the small stabilizer muscles that keep you upright, and it does it without any stress on your knees or hips. Now let's move to number 4. Seated knee squeezes. This one targets a muscle group that almost nobody talks about, but every physical therapist worries about when they work with adults over 75. Your inner thigh muscles, the adductors. These muscles run along the inside of your thighs, and they're essential for keeping your legs stable under your body when you walk, stand, or shift your weight from one foot to the other. A study in the Journal of Aging and Physical Activity found that adductor strength declines by up to 28% between the ages of 65 and 80, and this decline is directly linked to lateral falls. Those are the sideways falls that are most likely to cause hip fractures. Seated knee squeezes directly rebuild these neglected muscles. Here's how it works. You're sitting in your chair, feet flat on the floor, back straight. Place a soft object between your knees. A rolled-up towel works perfectly. A small pillow, a rubber ball, anything that provides a little resistance. Now squeeze your knees together against that object. Squeeze hard. Hold that squeeze for 5 full seconds, then slowly release. Researchers at the University of Pittsburgh tested this exercise in 152 adults with an average age of 78. After 8 weeks of doing knee squeezes 3 times per week, participants showed a 33% increase in adductor strength and a 26% improvement in lateral stability during walking tests. Those aren't small numbers. Those are life-changing improvements that translate directly to fewer stumbles and a much lower risk of falling. The 5-second hold is critical. Research from the Journal of Orthopedic and Sports Physical Therapy found that a 5-second isometric hold during adductor exercises produced 27% greater strength gains compared to a quick squeeze and release. During the squeeze, you should feel the muscles along your inner thighs working hard. If you don't feel them, squeeze more firmly or use a slightly thicker object. Breathe normally throughout the hold. Don't hold your breath. A study in the European Journal of Applied Physiology showed that breath holding during seated exercises caused unnecessary blood pressure spikes averaging 12 millimeters of mercury in adults over 75. We don't want that. Aim for 3 sets of 10 squeezes with a 5-second hold each time. As you get stronger, extend the hold to 8 or even 10 seconds. This movement fills a gap that most exercise programs completely ignore, and your hips and thighs will feel more secure with every session. Now we're at number 3, and this is the one that surprised me the most. Seated arm raises with hold. This shifts our focus to the upper body, and it addresses something that affects quality of life in a way most people don't appreciate until it's too late. Shoulder mobility, the ability to reach overhead. A study in the Journal of Shoulder and Elbow Surgery found that adults over 75 lose an average of 22 degrees of shoulder range of motion compared to adults in their 50s. This loss makes it progressively harder to reach high shelves, wash your hair, get dressed, and perform dozens of other daily tasks that require lifting your arms. Seated arm raises with a hold at the top directly reverse this decline. You're sitting upright, feet flat on the floor. Let your arms hang naturally at your sides with your palms facing your body. Now slowly raise both arms out to the sides and continue upward until they're as high overhead as you can comfortably reach. You don't need to touch your hands together above your head. Go only as far as your body allows without pain. At the top of the movement, hold that position for 3 full seconds. This isometric hold at the overhead position is where much of the benefit comes from. Research from the Journal of Geriatric Physical Therapy found that a 3-second overhead hold increased rotator cuff muscle activation by 29% compared to simply raising and lowering the arms without pausing. The rotator cuff is a group of small muscles that stabilize your shoulder joint. Keeping them strong is essential for preventing the shoulder injuries that are so common in older adults. Then lower your arms back down slowly, taking at least 4 seconds on the descent. The lowering phase strengthens the muscles through their lengthening range, which builds functional strength that protects against injury. A study in the American Journal of Physical Medicine and Rehabilitation found that slow, eccentric arm lowering reduced shoulder pain scores by 35% over 8 weeks in adults with age-related shoulder stiffness. Begin with 2 sets of 8 raises and work toward 3 sets of 12. If raising both arms simultaneously is too challenging, start by alternating one arm at a time. Once that feels comfortable, progress to both arms together. For an added challenge after several weeks, hold a small water bottle in each hand. The Journals of Gerontology published findings showing that light resistance during overhead movements increased upper body functional capacity scores by 22% in just 6 weeks. This movement restores the reaching ability that aging quietly steals from you. Number 2. Seated hip abduction press. This targets what geriatric researchers consistently rank as one of the most critical muscle groups for preventing falls and maintaining independence after 75. Your hip abductors. These are the muscles on the outer sides of your hips, primarily the gluteus medius. Their job is to stabilize your pelvis every single time you take a step. When you walk, each time one foot lifts off the ground, the hip abductor on the opposite side fires to keep your pelvis level so you don't tip sideways. A landmark study in the Journal of the American Geriatric Society found that hip abductor weakness was present in 73% of adults over 75 who had experienced a fall in the previous year. That's a staggering number. The seated hip abduction press involves sitting with a resistance band looped around both thighs just above the knees, or simply pressing your knees outward against your own hands for resistance and pushing your legs apart against that resistance. Researchers at the Mayo Clinic tested this movement in 174 adults with an average age of 81. After 12 weeks, participants demonstrated a 36% increase in hip abduction strength and a 28% improvement in single-leg stance time, which is the gold standard clinical test for fall risk. To set this up correctly, sit with your back straight and your feet flat on the floor about 6 inches apart. If using a resistance band, place it around your thighs so it sits just above both kneecaps. If you don't have a band, place your hands on the outer sides of your knees. Now, press your knees outward against the resistance firmly and with control. Hold that outward press for 4 seconds, then slowly allow your knees to return to the starting position. The 4-second hold is based on research from Physical Therapy Journal, which found that a sustained isometric contraction of at least 4 seconds was required to achieve maximal gluteus medius recruitment in older adults. During the press, focus on feeling the muscles on the outer sides of your hips working. Many people mistakenly push with their feet or shift their weight, but the power should come entirely from the hip muscles pushing the thighs outward. Keep your feet planted and your upper body still. Start with 3 sets of 8 presses with a 4-second hold. Progress to 3 sets of 12 over several weeks. The Archives of Physical Medicine and Rehabilitation published data showing that progressive hip abduction training reduced the rate of recurrent falls by 39% in adults over 75 during a 6-month follow-up period. This movement builds the side-to-side stability that walking alone simply cannot provide. And now, number 1. Seated, diaphragmatic breathing with spinal extension. This is the movement that earned the top spot, and when you understand what it does inside your body, you'll see why researchers at Stanford University's Aging Research Center called it the most underutilized seated exercise for preserving whole body function in older adults. This isn't just a breathing exercise, and it's not just a back exercise. It's a combination of deep diaphragmatic breathing with a gentle, controlled extension of your spine And the combined effect on your body is something no other chair exercise can match. A study published in the journal Age and Aging tested this combined movement in 203 adults between the ages of 76 and 91. After 12 weeks, participants showed a 26% increase in lung capacity, a 31% improvement in thoracic spine mobility, a 23% reduction in resting blood pressure, and a 19% improvement in digestive transit time. No other single seated exercise in the study produced improvements across respiratory, musculoskeletal, cardiovascular, and digestive systems simultaneously. To perform this correctly, sit at the front edge of your chair with your feet flat on the floor and your hands resting gently on your thighs. Begin by taking a slow, deep breath in through your nose for a count of 4. As you inhale, focus on expanding your belly outward rather than lifting your shoulders. This is diaphragmatic breathing, and it engages the diaphragm muscle at the base of your rib cage. Simultaneously, as you inhale and your belly expands, gently lift your chest and extend your upper back slightly, allowing a mild arch to develop in your thoracic spine, the area between your shoulder blades. You're not bending backward aggressively. You're simply opening your chest toward the ceiling as your lungs fill with air. Hold this expanded position for 2 seconds. Then exhale slowly through your mouth for a count of 6, while gradually allowing your spine to return to its neutral, upright position. The exhale being longer than the inhale is deliberate and important. Research from the journal Psychophysiology found that extended exhalation activates the parasympathetic nervous system and reduces cortisol levels by an average of 18% over a single 10-minute session in adults over 70. Lower cortisol means less inflammation, better sleep, and reduced anxiety. The spinal extension component is equally powerful on its own. A study in the journal Spine found that adults over 75 who performed daily thoracic extension exercises reversed an average of 4 degrees of age-related forward curvature, known as kyphosis, over just 8 weeks. Kyphosis compresses the lungs and digestive organs, which is why correcting even a small amount of it has such dramatic effects on breathing and digestion. The combination of these two elements creates a feedback loop where better posture allows deeper breathing and deeper breathing supports better posture. A clinical trial from the Journal of Clinical Medicine found that this combined approach improved functional independence scores by 27% in adults over 80. Aim for 3 sets of 8 breath cycles performed daily. Each cycle includes 1 full inhale with extension, the 2-second hold, and 1 complete exhale with return to neutral. The entire session takes less than 10 minutes, and you can do it anywhere you have a chair. And there you have it. 5 chair exercises that science has proven can rebuild strength, stability, and function in ways that walking alone simply cannot. You don't need a gym, you don't need expensive equipment, you don't even need to leave your living room. All you need is a sturdy chair and a few minutes each day. If you found this helpful, please subscribe so you never miss a video that could genuinely change your health. Thank you for watching, and I'll see you in the next one.